I think one thing we all have to realize is that health and healthcare is political. It's not partisan, but it's a political issue, how
Mhm.
we care for ourselves and how we care for our communities. And so it's a central issue in our election today. And even though healthcare is a provincial responsibility, there's billions of dollars that flow, as we just heard, from the federal government to the provinces.
And why isn't healthcare maybe getting as high a priority in this election as some other major issues?
Well, I think as Canadians, we're worried, right? There's unfair threats to our economy with tariffs, with the uncertainty of the political leadership in the US, and our way of life is threatened, maybe even a recession coming up,
Mhm.
how to find an affordable home. So these are all key issues, but without health, nothing matters. And I think a lot of our listeners, a lot of your listeners will recognize that. We're looking at our families, looking at ourselves. We're all going to face chronic illness in our lifetimes.
And as you know, as we've said, as Bill Bennett mentioned in that story we just heard, delivering healthcare is provincial jurisdiction, but there has to be some responsibility for the federal government when it comes to healthcare. What would you like to see the governments doing to address this right across the country?
Totally. I think there's real solutions that can be offered, and we have to look across the world at best practices. I think often we get a little bit, disadvantaged by comparing to our neighbor to the south in the States. And,
Hmm.
one of the advantages now, looking to Europe, looking around the world for trading connections, is we should also learn from other healthcare examples. And one example, and I was discussing with my MLA, who's the opposition health critic, yesterday about this, was that we should have guaranteed wait times. So, for example, in Europe, right, countries like Denmark and Portugal and Finland and Sweden, if patients don't get a hip replaced or knee replaced or their cataracts fixed in a certain amount of time, they can pick up and go to an adjacent country and get that done and be reimbursed for their care.
Huh.
Why aren't federal politicians talking about that? And
Right.
I'm trying in Port Hardy to engage my candidates for MP with this, and I've actively been in touch in my role as a family doctor.